I'm going to be joining Mark Litzel, and he's going to talk about various things, such as the use of targeted therapies. But the thing I'm going to focus on is reduced intensity transplantation. As I've said, in our UKALL14 trial, we have the largest prospective series of reduced intensity transplants in adults. I'm actually currently doing the final write-up of the paper. It's 250 patients, and the results are very good. Their 4-year survival is of the order of 54%, which is, given that the median age of that patient is 50, that's really a big improvement. We showed with our Fludarabine, Melphalan and FRCPath regimen that it was well tolerated. The transplant rate mortality was less than 20%, and there was quite mild acute and chronic graft-versus-host disease. Nonetheless, the results can be improved. The clear issue was relapse. There was relapse of the order of 28% at 3 years. And what we've had a follow-on trial, we're comparing the Fludarabine, Melphalan, FRCPath regimen with a regimen using low-dose TBI and low-dose cyclophosphamide. So that's a study, that's an impact study called ALL-RIC, and we've recruited over 60 patients to that study. And the goal of that study is with a low-dose total body irradiation regimen, whether we can reduce relapse. That's the main thing. The other thing I'll be drawing people's attention to is a very important retrospective study from the Centre of International BMT Research, which looks at the effect of graft-versus-host disease on the outcome of ALL transplants. And that's a study I participated in. The first author was Moshe Yeshurun, from Israel. It's published in Blood Advances. And that shows very clearly that if you get mild acute graft-versus-host disease, the outcome of transplant's better. There's better survival and less relapse. And so that gives us clear goals about what we should be aiming for.